All right, so it started recording. Welcome to our final lecture before our revision lecture next week. If you see anybody popping in, if you are able to, please allow them to join the lecture. So today we're looking at chapter 16 as well as chapter 17. All of you should have received your assessment 2 grades. And I mean, the quality of your assignments was really amazing. And I'm really pleased with the work that all of you have produced. So thank you so much for that. And also, please note that because I'm sharing my whole screen as it is, I'm unable to jump out of here to look at any of your comments. So if there's anything you need to ask or say, please just unmute yourself, because all I see is just exactly what you are seeing right now. So I don't have a separate section for chats. So I can't see anything. Okay. Okay, so the first part of the lecture will look at chapter 16, which is interpretation and reporting of assessment results. After we are done with chapter 16, we'll then start to look at chapter 17. But these are very straightforward, lecture content, and it's very easily understandable. So when we talk about interpretation, we're talking about interpreting our assessment results, because we would have assessed our clients or scholars or whoever it may be using assessment measures. And we can use assessment measures in research, or it can be part of practical application. So interpretation means making meaning of the information that we have gathered, making meaning of our results and putting it together, and finding ways to actually provide assistance to the client or the patient, assistance as in further interventions or recommendations, or even concessions. So in research, we're using assessment measures depending on the purpose of the research, and that's based on the research problem. So people who are conducting surveys to find out what the prevalence of a disorder is in a city or province or wherever that may be, that the purpose is to understand the prevalence. And so interpretation will be based on what information they have received. So that would probably be quantitative information. So how they interpret that would be, for example, 67% of the population meets the diagnostic criteria for major depressive disorder, for example. And then the practical application, it helps us to gain more information that actually helps us to better structure our interventions. And this can be used in child and adult guidance, in scholastic interventions, and to identify or diagnose psychopathology, to also determine the strengths and the weaknesses. And that's more for the scholastic type of interventions. And then it can also be used in selection, placement, and training in industry. And you would have learned some of that in your previous lectures in the first quarter of the year. So the assessments that we use are used to answer specific questions about a person. So for example, the question would be, why is this child not doing well at school? And so you will use a multidimensional process, as discussed in chapter 1 or in our first few lectures. And that's looking at multiple settings, multiple sources, um, uh, collateral information, getting collateral information from multiple sources. Um, and what we are asking could be, is it intellectual difficulties that this child is struggling with? Is it emotional difficulties? Is it environmental factors? So to answer that specific question, we need to consider a multidimensional process to understand exactly what could be going on. And so from this multidimensional information gathering process, certain results are obtained, but, which is a big but, the results need to be interpreted so that it can make sense of the identified problem. And it can help in formulating the appropriate and effective interventions that need to take place. And so the next thing we look at is what are some of the principles that we use to convey test results. And so there are ethical and practical considerations that we need to consider. So we need to consider the content. What content are we using, and how are we communicating our findings to parents? How are we communicating our findings to the child or to the adult, as well as to the multidisciplinary team, and the way in which we are conveying those results. So what is that information, and how are we, and the way in which we are conveying that information. And in terms of our ethical considerations, we always have to maintain confidentiality. So understanding that we can't divulge any information without your client's consent. And the information that we do divulge, it must be in the best interest of the client with permission. So if it's not in the best interest of your client, you probably need to consider then, why is it important for me to provide anybody else with this information? So that's sort of like chit-chatting or chatting behind your client's back on information that's really not unnecessary. Like things like, oh, did you know that her mom or this mom, the child's mother did this, or is dating another person, or is cheating? That's got nothing to do with the assessment. So it's important to maintain the best interest of your client. And you are allowed to share that information as part of a multidisciplinary team to other professionals, but also you need to communicate that to your client. So if you are working in a hospital setting, it's usually a given that you are working within a multidisciplinary team, because within that setting, there will be a ward round where you must provide that information to the rest of the team. And so we also need to be accountable for how we use the measures that we use, how we interpret and store these measures, and using measures that we are properly trained in, and that we actually have up-to-date knowledge of the measures that we are using. So if you've been trained in version 4 of an assessment, and now an update for version 5 has come up, you need to also gain some training in version 5. If the changes have not been that much, you can actually gain training by practicing, with a colleague, or having a supervisor show you how to use it. And we are accountable for using these measures in a sensitive and non-discriminatory manner. And we looked at confidential ethical considerations as being the first principle, and the second principle is your practical considerations for conveying test results. And with practical considerations, we need to convey test results in the context of the relationship or the situation with your client. We must be emotionally supportive. So conveying these results in a sensitive and respectful manner. We need to be aware of the client's ability to take in information. So we need to relay information at the client's level of functioning. So we must also give them the opportunity to express their feelings or ask for clarity, because they might not understand all of the technical jargon that we might use from time to time, although we probably shouldn't be using technical jargon with them. We should be using words that they understand, so speaking at their level. Your results must always serve the purpose of the assessment. If the purpose was to understand why they are struggling at school, your results should actually speak to exactly that. And your results should be rather in descriptive terms rather than numerical, because they will understand descriptive terms. So descriptive terms could be, for example, saying that there is a delay, like a delay of 3 months, a delay of 4 months, rather than saying they are in a percentile rank, or they are in, they scored this sort of standardized score, or a scaled score. So rather in descriptive rather than numerical. Descriptive could also mean average, below average, above average. Okay, so that's much understandable for clients. So avoid technical jargon and use understandable language, and try to contextualize your results so that it's more understandable for your clients. And then conveying children's results, we always need to involve children in understanding the reasons for being assessed. So in your test, if you have a case study, please do include being, having or setting out time to convey the results to the child, or involving the child in understanding the reasons why they are being assessed. So to the parents, you would explain what measures you are using. They won't understand exactly, but you can tell them what measures you have used to understand what sort of domain of functioning and what it helped you to understand. So some of the conclusions that you came to, and some limitations of the measures that you have used. So you must also be honest in how you convey your results, but honest, not brutally honest, but because you still need to be sensitive. So instead of using negative language, you try to use more positive language by emphasizing the strengths and encouraging the parents to also do the same, to see the strengths in their kids and not to focus too much on the weaknesses. Otherwise, they end up becoming frustrated, and the child becomes frustrated, and then they can't work together. So help the parents also to gain a realistic perception of the child, and you as the therapist or the clinician, you need to be able to anticipate that there will be emotional responses. And how are you going to then provide containment within that space? So always be ready to provide containment. And when you're providing feedback, if it's an aptitude or career assessment, you can provide that feedback to both the child and the parents. But if it's an emotional or behavioral assessment, that feedback needs to be spoken. You need to provide that feedback to the parents alone first before you have a conversation with the child. And so there are certain things that your written report should include, and your written report should always include the date of the assessment, identifying information, and the day and identifying information also includes the age of the child in years and months. So because with your norms, you need to look at years and months in order to score your assessments. You also need to include the purpose of the assessment and include only the relevant background information. So when you do the intake interview with the parents, you might get additional information that's really not relevant to your assessment. So you will know what's important and what's not important. And then you need to hold your audience in mind in writing your report. So for parents, you would write a report that's more descriptive, and to other professionals who understand standard scores and scale scores, you can actually make it more numerical. So you would need to also explain the report, the results to the parents. So after you've printed your report, you'd have to sit with with your parents and go through the full report with them and help them to understand what you have written up in the report. And then you need to also, in your report, list the assessment measures that you have used and how you have also gathered information. So how you've gathered information besides the assessment is that maybe you've gotten collateral information from the teachers and also from the parents, but also from your observations, clinical observations with your client. So that's how you might have gained some information. So you need to write that up in your written report so that they can see how you've gathered your information. You also need to concentrate on the strengths and the weaknesses. use general, understandable terms to describe behavior, and focus on your interpretation as well as your conclusion, which will inform recommendations. In writing your report, you need to uphold ethical standards and values, and it must be of professional quality. So make sure even grammatically that it meets grammatical standards. So you need to also be able to substantiate everything you have written. So if you are subpoenaed by the court of law, you need to be able to substantiate everything you have written. So even if you know you're not going to be in court, write it in a way that you are certain that if you were in court, you can actually substantiate everything you have written. So if you're unsure about anything, probably do not include it. If you are querying something, you can write it up as a query, but not as a statement, because those reports are used in the education system. They're used in clinical claims and in many other industries, depending on the referral question. So be able to ensure that what you have written is true and honest. Okay. And then your practical report, which is basically your fully written up report. And this is the standard that it must, this is what it should probably look like. You've got your date and you have indicated that this is a confidential report. So you write in bold confidential report. If you are missing the word confidential report, then your report is not confidential. Okay. And also one other thing, whenever you submit your report to your clients, or let's say your client has asked you to share the report with a teacher or etc., it must be password protected. And don't share the password within that email. You can share it directly with the parent. So that way you make sure that the report is confidential. And the next line would be reason for referral. So this is basically why the client came to see you and the purpose of the assessment. And then your third heading would be the relevant background information, which includes the identifying information, the age of the child, the school, the family constellation, and any medical or psychiatric conditions. And then you'd also include collateral information. So that would be the interview with the teacher, the school report, and and the observations within the classroom setting, or even at home, as well as maybe your initial observations. Then you need to list all the assessment batteries that you have used, and then you have to complete the results for each test. So when you write up the information of the results of each test, before you include the results, you need to indicate what each of these tests measure, and then you include the results. And then you will add a section on behavior during testing. So those are your qualitative observations during the assessment phase. And then your next heading would be your interpretation or your integration section, where you combine all the information from the referral question up to the behavior during testing. And then you would make your recommendations, which then flow from the interpretation. And so now we'll move on to chapter 17. Are there any questions thus far on chapter 16? Chapter 17 is a very short chapter. And also, yes, thank you.
Hi, Tebogazi.
Hi.
I just wanted to understand how far does the confidentiality part go when it comes to a child? Let's make an example. Let's say a child has anxiety issues, and they're seeing a clinical psychologist,
Mm,
and the parents, maybe the child stays with a grandparent and they're taken
mm,
to a psychologist, but then they would go after going for a number of sessions, the family doesn't know what triggers the anxiety for the child.
mm,
And the psychologist in that case tries to maintain the confidentiality issue. how does one balance ensuring that the family is aware of the triggers that lead to the child experiencing anxiety, whilst at the same time maintaining confidentiality between the therapist and the child, a teenager,
Okay.
for example?
Okay. Thank you so much. So this is a teenager who's being seen by a therapist, and you are trying to maintain confidentiality, but you understand that they are still being impacted in the family environment, and you would like the family to really understand what's happening. So in that case, you you need to get buy-in from your from the teenager or your client. And psychoeducation is always the first thing that you would do. Our lecture is not on that though, but I will talk about that because our lecture is on assessment. But I'll go with what you are asking. So you would actually have a conversation with your patient and help them understand that if they're having some triggers at home, it's actually important for you to have the conversation with the parents, and just disclose as to what some of these triggers are at home. In all honesty, for me, if the child is struggling with anxiety and they've been brought by the parent, I would I would disclose to the parents that there is a diagnosis here. Your child is struggling with anxiety. And sometimes that's very important, especially if the child is severe enough that they probably need to go on medication. If they need to go on medication, that they still have to go with their parents to the psychiatrist or to the GP if it's not that bad. So you do need to get that buy-in from the client and just help them understand how important that would be. And so there's also risk. So you are assessing risk. So when there is risk, the confidentiality is sort of breached in a way, because a severe anxiety episode could lead to so many other things, and you would not want a teenager under your care for something to happen at night while you are sleeping, right? And they are experiencing a severe anxiety which you have not communicated to the parents, and they start self-harming to the point that they might you know end up taking their own lives. So you want to make sure that any clinical diagnosis is communicated to the family, and that you provide psychoeducation for the family as to how they can help the child at home as well. But I would certainly get buy-in from the teenager, and also just tell them, I think it's important that I speak to your parents about this, and it will be helpful for you if your family understands what's going on, so that they know how to support you at home, and to also decrease the stresses at home. So usually they are understanding, and you can. I didn't catch your name, who the person who asked the question, because I on my screen I only see chapter 17 factors affecting assessment results. And please say your name and if I've answered your question.
Yes, you have answered my question. It's
Okay.
Tutugi Lembata. Thank
Okay.
you.
Thanks for your question, Tutukil. Okay. All right. Yeah, it's always tricky.
Ma'am,
Yes.
I just have a question as well.
Can you
In
please
terms,
say your name because I can't see it?
it's AD or Adrian. I don't know which one I am on the system.
Is it Adrian or are you the one with
Yes,
the horses?
yes, that's me.
Ah, okay.
I was wondering, when you are doing an assessment with a younger child and you need to convey the results with the parents, until what age do you have to, I don't want to say get the child's consent, but you said we need to make sure, well, we need to get their consent, but until what age? Because obviously a very young child isn't necessarily going to understand
Yes.
why it has to be told to the parents.
Mm. I think the mental age of each child is different, when versus chronological age. But there are maybe, I mean, with a 10-year-old, I would still just speak to the parents, as you are saying. But if they are in high school already, then that's different. They're not in primary school, but when they're in high school, they sort of understand, and they might want to be able to have some sort of autonomy. And each high school scholar is different due to mental age. So you might find that a 13-year-old might be functioning at a level of a 16-year-old and wants to know everything. What are you going to tell my parents? Please don't tell this to my parents or that to my parents. But remember, with assessments, the parent has brought the child, and so those results in any case have to be released back to the parent. You have to inform the parent, because they are the ones who are going to be making the decisions forward to send those results to the school. These results are meant to be helpful for the child. So with psychometric assessments, if you've assessed the child does not come to you and say, I want to be assessed. So for you, when they arrive, you need to find out if they know what they're there for. And then you need to inform them why they are there, but obviously in a nice, friendly manner. And then you can inform them, okay, so we'll be doing some of these things. We're going to be doing some fun things. And after that, I will be sending some of the feedback to your mom. And if that's okay with you, the school might need some of this information, but I'm not going to tell them things that they don't need to know, only things that they need to know so that they can help you at school. So that's all you are really communicating to them, because this information still has to, we still have to do something with this information. It's not like we will sit with it and we can't we can't send it. I mean, the parents are always the first point. But with teachers, if the parents say, no, you cannot forward any of this to the teachers, I'm going to keep it to myself for now, then you really can't communicate with the teachers. But with them, for a minor, that information must go back to the parents.
Okay, thank you. That answers
right.
my question.
Okay, perfect. All right, so we will now look at chapter 17, which are factors affecting assessment results. So as we know that in psychological assessment, we can't really measure an ability directly, and it's usually inferred from a person's test performance or score. And so a score is basically an indirect measure of the strength of the attribute or the ability that the person possesses. But a score is not the only thing that we should be looking at. So it's only one piece of information, because there are other factors in addition to their score that can actually influence their scores. There are other factors in addition to their inherent ability that can actually influence their scores, and as well as the meaning behind those scores. So if this is not understandable, think about your first test, and that score didn't reflect your actual strength, and that something else did influence your score. Perhaps there wasn't enough time, or you spent too much time on other questions, etc. So there are other things, or you may have been ill at the time, or you were too anxious. So we can't interpret a test score without taking into consideration the person's context, as well as other intrapsychic issues that might have been going on at the time. So we need to view assessment results in context. So we are viewing assessment results in the context of the biological what is it? A biological approach. So looking at age-related changes, and how with age you might have memory loss, or you might be gaining more knowledge the older you are getting, especially from the age of 18. You are gaining more knowledge, you are learning more, and you are able to use that knowledge, but obviously after a certain age, you start to have some sort of memory decline. So we need to keep in mind some of those biological factors. Then there's also physical factors that are involved that could impact on assessment results, but we'll look at each of these in detail. There's also intrapsychic factors like transient conditions such as bereavement, feeling sad on that day, but not necessarily having a major depressive disorder. And then psychopathology. So some people are on medication for major depressive disorders, PTSD, anxiety disorders, and so we need to keep that in mind. So even when you assess anybody in your with using psychometric assessments, you need to find out if they are on medication on that day, because we know that medication can impact your focus. It can, unless obviously it's medication that helps you to focus. But I'm just thinking even allergics. If I've had allergics in the morning, I can't function very well. So I know not to have the drowsy allergics in the morning. So and so for you also, please don't take allergics before you write your exam. And then we also look at social factors such as schooling, language, the culture, environmental factors, which all have an impact on assessment results, as well as test wiseness. Okay, so with age-related changes, looking at the biological context first, chronological age does affect test performance, but what is great about that is that the measures are developed for certain age groups, so we need to make sure that we use appropriate measures for that specific age group, and we use the norms for the different age groups that we are measuring. And then the physical impairments can affect test results, and that can be, hearing, problems with hearing, speech and physical impairments, having a serious illness on that day, having a specific head trauma, cerebral palsy, and other physical conditions such as pain. Imagine trying to focus and complete an assessment while you are having physical pain. And just like I've said, medication can impair just your brain a little bit. And then chronic alcohol and even substance use. And then with the intrapsychic context, we are here looking at the person's experiences and their feelings. So the transient conditions are sort of feeling stressed or anxious that can affect how you perform on a test. Being upset, imagine being upset at your partner, or being upset at anybody, at your boss, and now you're trying to focus on this assessment. There will be times during that assessment that you'll be constantly thinking about that boss or that other person that has upset you. So we have to keep those matters in mind, and that's why observing your client take the test is important, because if you can see them thinking very deep in that moment, you could ask them, what's going on? What are you thinking about? You seem a little bit upset. So that you can contain them in that moment, so that they can be able to refocus their mind. So also being bereaved or worried about something can impact your performance, and also experiencing post-traumatic stress symptoms, and not necessarily, so like maybe an acute stress disorder at that point. And then psychopathology, if the psychopathology present, that can definitely impact on test performance. Depression obviously can manifest in problems with memory, motorcycle slowing, and difficulty with effort for cognitive tasks. So not really being able to think and problem solve. And then we move on to the social context, and we'll look at schooling, the impact of schooling, impact of language and culture, the environmental factors and the home environment, and how that can actually impact on a person's test performance as well as test wiseness. With schooling, so there has been a strong relationship between scores on intelligence measures and scholastic and academic achievement. So if you are an average student, the scores on intelligence testing usually do show that you are an intelligent student, like you are sorry, let me get my thoughts together. Schooling, you are an average student, and IQ test would also show you an average student. But then when the correlation is skewed a little bit and there's no correlation, then we can start to think, okay, maybe there's something else happening other than IQ. Okay. So schooling influences how we think and how we reason, how we problem solve, and our work ethic, and whether we can work independently or we'd rather work, in groups, etc. And so all of you in the class, think about how your schooling years influenced the way you think and the way you problem solve. And if you think about it, you probably don't think the same way as your other classmates think. You probably don't think the same way I think, because we come from different environments and we've been to different types of schools, and the type of school that I went to sort of shaped my reasoning a little bit, and maybe yours did too. And then in South Africa, we can actually say that the grade or the mark or the score that scholars get at school are not always the best indicators of what a person is able to achieve. And so because of that, the quality of schooling must be taken into account. And we also need to consider the academic language being different to the home language. So learning in a different language, but at home you're speaking a different language. So then which language do you actually think in? Which language do you actually problem solve in? Must you then now try to translate your answer into um, the language of school instruction, and how long does that process take? Is there then some sort of delayed processing because of that? So I mean, I know I used to think in Xhosa, and I sometimes still think in Xhosa, and then I have to quickly translate to English. It does happen automatically in the brain or in the mind, but when you start doing that, it takes a while. But once you get used to it, it's a much quicker process. And so because of the schooling experience, we all like how different our schooling experience is, our ability can actually be underestimated on cognitive tests. And so obviously this is why there has been a lot of adaptation work on our cognitive tests. Okay, so the potential ability of the client has to be considered than merely skills obtained from formal schooling. And newer intelligence measures, they are addressing this issue. And so with language, one thing that comes up for me is that we sometimes use a combination of languages, and you might be Afrikaans, but you might not be really fluent in Afrikaans, and you might be mixing your Afrikaans with English, and maybe what do you call it? When you slang, could be like a slang Afrikaans. And whereas, even, I mean, teenagers nowadays use language that I don't even understand, and I have to ask them, oh, what does that mean? I mean, it's words that are probably not even in the dictionary. So there's a lot of slang out there. Even with Xhosa, there's a lot of language, like slang, that I don't understand, and we have to actually ask. So this actually does make it tricky for our assessments. But what also makes it tricky is the language of instruction at school might be different to the language spoken at home. So then the question is, which language do we test this? Do we use for testing? And so if this question comes up in your exam, so I do want you to think about it. But one other simple way is to do a language proficiency test. But you need to be able to tell me why you would do that, what it would help you with, and why you would make that choice. Okay. And then if, let's say you decide to use the home language, I need to understand why you are using the home language. But actually the best thing to do within our context is to use the language of instruction at school, sorry, the language of instruction at school, because maybe usually when we get referrals for assessments, it's because there's issues at school. So specifically with IQ assessments, it's usually because of poor academic performance. And obviously you are checking other domains, but now if the child has obviously been at the school for a number of years, I would say assess using the language of instruction. But let's say the child has been at the school for only 6 months and is coming from an Afrikaans language of instruction school or different other language like isiXhosa or isiZulu. Then you could provide evidence as to why it's important to assess this child using their home language, because that's the language they were taught in at the previous school 6 months ago. And so is this an adjustment issue at the new school, and is it a language issue at the new school? And so with your IQ assessment, if you are assessing them using the language of instruction at their previous school, which was 6 months ago, you are actually getting good, reliable, and valid results. Okay? But you need to back that up also with their academic record from that school. And you could also use an assessment that is like the progressive matrices, which does not use language. So that's the safest one to also use. But using the language of instruction from the previous school will help you understand what the IQ range really is, and whether with this new school it's actually a language issue. And that maybe one of your recommendations could then speak to more tuition or additional learning classes for English and comprehension. But you will not be diagnosing this child with a specific learning disorder, because they don't have a specific learning disorder. They just have not been learning in English. They have been learning in Afrikaans, and the IQ test says they're above average IQ. So the problem could then be the language. So language is very important. And obviously, if you as that assessor or as that clinician, you're not proficient in Afrikaans or isiXhosa, I would recommend that you refer the child to somebody who's proficient in that language. Okay. And then culture also has a pervasive influence on the way we learn and how we think about things and how we behave. So there are not necessarily any culture-free measures, but we as practitioners, we need to be sensitive to culture fairness in assessments. And this is a nice picture that we can think about when it comes to assessments and culture. If you look in the background, you can see there's huts and whatnot. And we used to play this game actually when I was younger. We used to sit in wheelbarrows, and one would push and then the other one would get off and push. But they do have this thing at the schools now, and it's called something else. But the kids have this as an activity, but they don't use wheelbarrows, but the stuff actually does look like wheelbarrows. But with this particular image, if you think about this child, imagine asking them, what does a tennis court look like? Asking them about what a computer does, what a computer is. That's not a culture sensitive assessment, because it's not going to give you a valid, score. It's gonna give you a very low IQ score, but that's not the. It probably won't be a true measure of these kids' abilities. They're probably really great at problem solving and doing things, but they don't know what a tennis court is, and they might not know some of the questions you are asking. So it's important to look at the person's context um, before you use any of the assessments that we use.
Ma'am,
Yes,
this is Mushane.
yes,
I just have a question. Let's say like the practitioner or has is racist. Are they
yes.
allowed to say no, I'm only gonna test this race because I'm comfortable with them? Or I don't know. Or you understand what I'm saying?
I understand what you are saying. And luckily, in masters, the screening is very harsh. It's quite hectic. And so nobody will make it through to being a clinical psychologist, educational psychologist, if they're actually racist, because it starts from there already, where you do your hours already in masters. After that, you've got your internship and then ComServe. You will never pass if you are racist. So it's yeah, it's not likely to happen. But let's say they are racist, that's unethical.
And then they could lose their thing. Could they lose their practice number, whatever, their license?
They probably won't in that manner, but because it has to first go for investigation. So they'll be asked a bunch of questions, client will be asked a bunch of questions, and they'll probably track the history. And if this is the first time that it's happened, and they probably going to deny it anyways, unless it's recorded. They might get away with a fine. But if there's no evidence to prove that that's what had happened, then it's not nothing horrible will happen.
Oh, okay.
Yeah. But from all the clinicians that I've seen, I think the screening process in masters is really great, because I have not seen a situation where clinicians have refused to see a certain race, but instead some clinicians will say, like in their profiles, that they are only, they practice in this language, or they cater for this language. But also it does make sense in a way, because let's say you are in Eastern Cape, obviously not maybe Port Elizabeth, Eastern Cape, but like in the Bundus of the Eastern Cape, it's probably fair to practice in isiXhosa. So maybe they would mention the language just to show that, okay, I'm proficient in this language. But I've never heard of anybody saying I can't see you because I'm racist. So that would be certainly unethical. And as clients, we are allowed to report anything that seems unfair or discriminatory, but it will be opened for an investigation. But if the investigation or the people that are investigating find no evidence, it's just like the law. Yeah. Okay.
Oh, okay. And then the thing is, it's called a soapbox derby. We used to do it in primary school. When we'd make these little